Um, Hello, everyone. Welcome to this first webinar of our second series of the initiative 2020, a year without public space under the COVID-19 pandemic. My name is Luisa Bravo. I'm the founder and editor-in-chief of the Journal of Public Space. And I'm promoting this initiative through my non-profit organization, City Space Architecture, in partnership with the School of Architecture at the Chinese University of Hong Kong. We start today, as I said, our second series after a very successful first series in May. And today the topic is COVID-19 challenges and responses in informal settlements. We have an amazing panel of speakers, very much into research and practice in informal settlements. And I'm happy to have today as co-host Hendrik Tieben from the Chinese University of Hong Kong and Gregor Mews from the Queensland University of Technology and Urban Synergies Group. Welcome again, and I hope you will enjoy our webinar. So now it's up to you, Hendrik.
Yeah, thank you very much, Luisa. Just some housekeeping at the beginning, just for those that join us for the first time. In these webinars, you cannot use a chat function, but you can use, you can write us your questions with the Q&A function on Zoom. And while you are writing those questions, my colleagues Yin-Fen Chen and Stephanie Cheung, they will go through all those questions and select some for the roundtable discussion at the end. And as we cannot answer all the questions, what we organize at the end of the month, so it's the last Thursday, we have a special session where we pick some more of those questions that were raised during the webinars. Of course, also not all, but a little bit more, so that you can also have the feeling that you can get answers to your questions. So that's all from my part. I come back in the roundtable discussion, and I want to pass the word to Greg Mews from the QUT in Brisbane, and he will moderate and prepare also this particular session. Okay, Greg.
Yeah, thanks, Hendrik. Hello, everybody. So yeah, as already Luisa and Hendrik briefly touched on, we've got a great range of speakers this week for you. In particular, they're bridging the nexus of not just research, but really going into grassroots and giving you some of the insights of their everyday life existence and what their experience looks like on the ground in some of these communities. So a part of my input, there we will have Rasmus Bering talking first from Dreamtown. It's a Danish NGO based in Copenhagen, doing a lot of great work across Africa. Then the second speaker will be Katie Suresh, one of our dear colleagues from ActionAid India, and reporting from the latest developments across the country there. Then after that, an academic contribution from Josephine Malonza from the University of Rwanda. And yeah, there you go. And we're followed by some really grassroots, tangible activist reporting from two dear friends, which we met at the World Urban Forum. It's Tatenda, Churu, and Casper, Chigama. So thanks for everybody for joining us. So before going into it, please let me share briefly my screen with you. Okay. I'd like to just briefly provide a short, very brief little introduction on the conceptual level that helps us to frame our conversation today and why this is such a pressing issue. We know, there we go. Why this topic particular? There was recently the UN report coming out, which really crunches down and condensed the issue, and in particular pointed out some of these pressing facts. The first one is we know 1 billion people around the planet live in informal settlements or in slums or favelas in very overcrowded and inadequate housing. They are most impacted by the virus because of these circumstances. We do know also more than 95% of these cases happen in urban areas, and in total 2.4 billion people lack adequate access to safe water and sanitation in those communities. Yes, it is an urban issue, and already over 1,430 cities and 210 countries are affected by COVID-19, so pretty much all countries on the world. So often what we know, those people which originally moved from rural areas to cities in hope for better urban lives and having their dream realized to a more healthier and fulfilled life as often remains a dream. So therefore often the vision of having higher livability is really in the far distant future. So particular coming back to public space, there's a really strong link for our discourse in relation to the Sustainable Development Goal 11, Sustainable Cities and Communities, but particular the sub-target 11.7, in which we're by 2030, we seek to provide universal access to safe, inclusive, accessible and green public spaces. So we know there's a plethora of different challenges coming towards us, which are directly threat to the health and well-being of those vulnerable community members which live in these communities. So they range from the lack of the voice in the community, lack of access to education, lack of employment opportunities, social exclusion, spatially as well as in the decision-making processes, exposure to poor housing conditions, poor access to fresh water, sanitation, as I mentioned briefly earlier, gender-based violence, early pregnancy, no access to health service, drug and alcohol abuse, criminal activities, and particular overcrowding during the COVID-19 pandemic is also a real challenge. So with these in mind, I just like to draw your attention to some of my own conceptual angle to that, because I've been privileged enough to work with Dreamtown in Sierra Leone on subjective well-being and public space intervention. So I just briefly put in, what do we mean by subjective well-being? That is really a person that reports on their cognitive and affective evaluation of his or her own life. So with that in mind, we can actually understand and delve into the lived experience of those people to really understand what's going on. And that brings me to also some of our speakers will touch on that we really tackling this human-centered design approach foremost from the bottom up as part of this webinar today. And on the conception level, I'd like to introduce you, maybe some of you have heard of that before, but the dialectic between space on the one hand and then the concept of urban lovability on the other, because it is something complex and also not so easy to grasp. So please follow me on this chart ahead in front of you, this graph. So on the one side, we know people and spaces, they are informed, they have different, people play different roles, have different responsibilities in these communities, their needs have to be met and their perception is different. So it very much comes down to the human experience and is very directly linked to their subjective well-being. Yet together, we know people individually as well as collectively, we do create spaces, and we do know a space is more than just a physical place. Yeah. And there is this relationship always going on between the space and the physicality, the materiality, which is a place. Both is being conditioned and shapes itself vice versa, and then also leaves a big impact on the people. So this concept of urban lovability, you can really hypothesize with this kind of concept that we really create context-specific conditions in which, with people in which the possibility to embrace urban lovability can be transformed in their environment as well as their well-being. So spaces in essence are literally socially produced. So with that in mind, the work what we've done in Sierra Leone, there we found really nurturing ground there. And the image in the middle is, that's what we found after Ebola hit the country there, and they had this, and the civil war and all this, they started this campaign, Sierra Leoneans say no to hate speeches. So it's all about agape, bringing out this compassionate affection towards another, to really lift the collective spirit in the country, to find a way of how they can break the cycle. Particularly with our intervention, we targeted and created spaces which are first coming through the people to empower them through education and through dreaming processes, how they can break that cycle. And at the same time, we were eager to measure their level of subjective well-being. So there are 2 resources out there which we have published on that, in case you're interested. So what does really urban lovability mean then? So it's a positive and voluntary intrinsic feeling or compassionate affection turned into an actuality. It uplifts the individual as well as the collective human spirit as part of our everyday life. And it offers an inclusive approach to our collective state of human existence. This all in total can improve our subjective well-being with a sense of immediacy. So this is very much more than creating big infrastructure which delivers higher livability, because often that is really this far-reaching goal which most of the people which living in these communities are hardly able to reach. So by linking this everyday life experience, this concept of urban lovability and the collective human existence becomes meaningful. And then how do we measure something so intangible? I mean, and there are certain ways which you can bring together to get really an understanding and perhaps shift the paradigm to a much more holistic view of what's going on. So on one hand, and I'm not going into that much in detail, is the social capital, which you can actually measure and see in communities. And the other hand, then there is this collective efficacy. That is about the ability to mobilize and undertake collective action. Very important when you link it to empowerment and education. And you can really shift social norms and break through stigma. Particularly during the times of COVID-19, we're really very much facing the stigma again, and we have to really be mindful of what kind of future we wish to co-create. Subjective well-being is a very powerful tool to measure that well-being of an individual and then aggregate it up to a higher level to really see what are the pressing points, where do we can put our energy in to really drive some real change within communities on public health level. And then, of course, space intervention. We know all the wonderful placemaking initiatives which are happening around the globe, but more though also it is a way of how we modify materiality. And this includes all sorts of structures which cater for health and well-being of those people which live in these communities, including social infrastructure and so on. So with that in mind, I'd like to finish up by giving you this quote of Jane Jacobs: "Cities have the capability of providing something for everybody only because and only when they are created by everybody." And what we can see, in particular in the global south, this is often doesn't happen. So let's start this discourse now on this very pressing issue. And I'd like to hand over to our first speaker, Rasmus Bering from Dreamtown in Copenhagen, which was very much part of our collaborative work in Sierra Leone, but I'm sure you will talk a great deal more about that. Thanks. Over to you, Rasmus.
Thank you, Greg. So thank you so much for the invitation to be part of this seminar. It's as a practitioner, it's wonderful to have this chance to take a deep breath and start actually to reflect a little bit on our practice. What is it that we do? My name is Rasmus. I'm from Dreamtown. Dreamtown is a Danish NGO that works across Africa on public spaces. The way that we work on public spaces is that we see it as a youth empowerment process. So the work that we do produce public spaces, but the reason that we do these public spaces is to work with youth around taking ownership and develop their skills in project management, participation, advocacy in the process of actually developing these public spaces. Today, I would love to share with you a presentation on our work on public spaces, which takes place across urban Africa. I have called this, this presentation the Nexus Space, and I will come back to the reason why I'm calling it the Nexus Space at the end of the presentation. But what this presentation is really about is the power of public space in urban slums during the COVID-19 pandemic. For the next few minutes, I will talk about COVID-19 challenges in urban slums, a case on Sierra Leone where we're working on safe spaces, a case from Uganda where we work on green spaces, and finally wrap up with some lessons learned and perspective on future research. So as Greg also touched about, there's this wonderful report or response plan from UN Habitat that really shows 95% of all the cases are in urban areas, and where we work in urban Africa, we see that 60% of the population live in informal settlements. This data is substantiated by looking at the latest SIDREP from Sierra Leone of the cases of corona. As you can see, by far, most of the cases are detected in the capital Freetown, Western area urban. As we can also see, there's no detection of death, but what we also know is that there's a big shadow field around these numbers. So we suspect that the cases might be even higher. So when we talk to the people around these slum communities about what do they see as the core challenges that we need to address, we see different ones. One is, of course, this: how do we create awareness on the COVID-19? And we see a lot of NGOs doing programs on awareness raising. But for instance, from Sierra Leone, what we also know is that their understanding of the crisis and how to protect themselves is actually very big. I mean, they went through the Ebola epidemic, and I think that it's fair to say that they are probably the global experts on how to protect yourself during a crisis like this. Of course, what the real challenge is that you don't have access to the infrastructure and the resources that enables you to protect yourself. So you don't have access to sanitation, and you don't have access to health, which is like one of the direct challenges related to the crisis. And then it's also a question about how do we support people's livelihood in situations of lockdown and distorted markets. It's very difficult for people to meet their basic needs just to get food on the table. You can't stay in your home when you need to go out and work. So how can we protect people's livelihood? And then, as we also saw during the Ebola crisis, how do we combat gender-based violence in teenage pregnancies? During the Ebola, we saw that the level of teenage pregnancies and violence just skyrocketed during the crisis, which was also due to the fact that the schools were closed and the students and the children were at home, where there was no people to really look over them and protect them. So we have the direct effects, which relates to health, and then we have the indirect effects, which relate to livelihood and gender-based violence. So my proposition here is that public spaces can be an important part of the solutions to many of these problems. And I will talk a little bit about why that is now. So here's the first case. Here we are in Freetown. So for the last year or 2 years, together with Urban Synergies Group, we developed public spaces, youth centers, creative hubs, hangout spots across Sierra Leone. I think we developed more than 20 public spaces. When we developed these spaces, the intention was to create a cool, creative, inclusive environment for young people. What we see now during the COVID-19 is that these spaces are a really important resource for us, because now we actually have access into these communities. We have a gathering point where young girls can come and meet us, where they can get non-formal education, where they can report if a crime takes place, where we can actually install water, where we can distribute sanitizers. And if we hadn't gone through this lengthy process of negotiating land and finding the space and working with community informal and formal power structures, then we wouldn't have this access to actually distribute these like very important basic supplies, and also to initiate a monitoring mechanism in terms of violence. So this is a case in which we see how a public space can actually be transformed into a function that takes care of a number of the challenges that we see during COVID-19, even though it was not initially designed to do that. So this is another case. Now we are in Kampala, in Uganda, where we for the last year have worked on developing parks, green spaces, urban gardens, together with local youth groups. So when we just started this project, I mean, the idea was to create very much along the livability paradigm, like a nice and vibrant atmosphere in the slum, a cool environment. What we see now during the COVID-19 is that these small gardens, as the one you see in the picture, is actually providing people with a source of livelihood. This can actually cater for their basic needs when it's too expensive to go to the market to get food, or if you can't go out of your house to get food. We have also seen how we can transform, if you can see in the pictures, this is like actually a larger space we're working on to make like into a green park, that we're using these spaces strategically to install, this is a tippy tap, so it's like a local innovation on how you can wash your hands, and where you can create awareness about how to stay safe. And now my alarm went, so I'm already on 7 minutes. So lessons learned and future research. So what we see is that spatial access is vital in an emergency. If it wasn't because we had these public spaces, it would be difficult for us to intervene. Another key lesson is that the spaces that we work on, they need to have like a multi-purpose, and they need to be adaptable public spaces. So that you can't put too many fixed functions into them. They need to be able to adapt together with the people, together with the context, together with the evolving situation. And finally, is the term that we're working on now. How can we think about public spaces as a nexus space? So in the development world where we come from, we talk about the nexus between development work and humanitarian work. So what we're really looking into now is to see how a public space both can have a function in times of development, but it also can have a function in times of a humanitarian crisis. So I think maybe I just want to rephrase it. So we are talking about a year without public space, but for us it's actually really a year with public spaces where we see the power of space. Thank you so much.
Thanks, Rasmus. That was spot on and very fascinating, particularly on the nexus space. That is a very nice novel approach under COVID-19, what emerges there. So from Denmark over now to Katie Suresh, our contributor from India. Yes, Katie?
Thank you, Greg. I hope I'm clearly audible to all of you.
Wait, maybe Rasmus, can you
sorry.
stop sharing?
Yeah.
You need to stop.
Yeah. Okay, yeah. Perfect. Yeah, thanks. Okay, Katie, please. It's you.
Yeah, thank you. Thank you very much. What I'd like to do is to explain also, given the fact that I come from an international NGO which works in India, and my own work intersects urban and labor. So I would look at the informal spaces from within that intersection. The creation of informal spaces and the conditions which create the informal spaces, and therefore what might be the kind of views that we need to take as we move forward. Just to contextualize ActionAid's work, in the last 60 odd days since the lockdown started on the 24th of March, we have been in relief operations in about 25 different states, provinces of India. And we have reached out to almost 3 million people on a day-to-day basis with relief supplies and rations and relief supplies. We've also recently just completed a national survey, which included about 11,000 people, 11,000 plus 11,500 people, of people who were in transit, people who are moving from one place to another. So these are the two broad sets of pieces of work within which I'm going to state what I'm saying, which is the current narrative. So I would move a little away from looking at any one spatial area, but to look at the larger, broader kind of context, and then bring it down to something which will be helpful for us to have a conversation around. So the announcement itself was something which was sudden, and it was a surprise announcement. And what it hit was the poorest temporary internal migrants, which is estimated at about 100 million, who are engaged in complex, circular, and seasonal routes of migration. And within days of the lockdown announcement, accounts started pouring in of migrants suffering from starvation, fatigue, road accidents, as they started their long, treacherous journeys back into the source states from which they came. Average distances about 500 kilometers of walk during the lockdown, and in some senses, that itself shows you what the lockdown meant for different classes of people across the country. For some, it was staying at home because there was a home. And for some, it was fleeing from what was a temporary home to the shelter of what they thought what was their, permanent home. The experience has been that you've had heavily policed bus terminals within cities. State boundaries were being sealed. There was a fair degree of violence which has been reported in the media, where the internal migrant, and let's be clear, when I use the word migrant, it's internal migrant, and police encounters were largely brutal. The gravity and the cruelty of the migrant crisis came under sort of intense public scrutiny, and it probably is one of the most harrowing experiences since the time that the country went through the partition. The reason why I'm giving you this backdrop is because I think we have to understand also the labor drain that is taking place from very large cities, and therefore the kind of effect it was going to have on informal settlements itself, because the drain itself is causing a change in the nature of informality and informal living that is taking place here. There are those who have fled. We don't know how soon they're going to come back, or if they're going to come back. The nature of their experience, I mean, most of them have been largely in the construction and other kinds of low-skilled work. The movement of 100 million people inside a country is not a small event. It has a huge impact. And I think that the ways in which our cities would have to respond, and the informal spaces would have to understand the gravity of this situation, is also going to be something which is of a nature and an order, and that's the more important point which I'm making, of an order which is very different. There have been different states, different provinces in India who have done things uniquely. One of the states, for instance, it's worth mentioning is Kerala, where, for instance, they felt that the need to explicitly reassure people that they would not allow anybody in the state to starve to death as a consequence of the lockdown. The state, for instance, calls the migrants their guest workers. Nomenclature sometimes might be semantics, but quite a bit it does influence the politics. So the way in which that state treated its migrants was very different from the way in which other states did. I'm just giving you one end of the spectrum. There are other states who have also done good work, but it's very important to understand that the experience of those who are what in ActionAid we call the city makers, the ones who actually built the cities and the ones whose labor contributes to the making of the economic model. Their experience of the city has been one of abandonment. They're being abandoned at the first sight of trouble. They're being abandoned without much of thought to what they ought to do. Social distancing norms, while being announced, if you look at the informal settlements, we have an average of about 5 to 6 people in a room. What kind of social distancing norms are possible in that kind of this is an average size. We've been working with, in the national survey, for instance, we've been interviewing people who have been migrating in and out through transit camps, through quarantine camps, and in states where they live and in the states where they are going back to. And in that survey, we are finding that the average, the space that a person is occupying in a normal room in a city is about almost 10 people to a room in this kind of a context. And so therefore, it's very, very important for us to understand in the COVID-19 situation, what it has thrown up is that it's completely unmasked the problem at a very gigantic level. And I think that also demands of us an imagination of how we look at informal settlements at a scale which is not something that we have dealt with, at least not in India. We've dealt with it in the past. The templates of housing.
I think that time's almost up. I think we might need to come back to you. I think it's incredibly interesting to follow your descriptions, because of course it shows the magnitude of the problems. Just wondering if we should maybe still have the other 2 presentations and then come back, because I think it's a very interesting contribution you give. But I think maybe it's good to mix them with the others, right? Yeah.
Yes, and we also received a question for you from the audience. So maybe later you can also answer to this question.
Yeah.
Okay. Yeah, thanks, Katie. And with that, I would like to hand over to Josephine Malonza. And interestingly enough, her PhD thesis was on bringing life into urban public spaces. So I think in the post-COVID-19 environment, particularly important, interesting. So over to you. Thank you. Josephine, we can't hear you. Okay, there you go. Now, yeah, perfect. Over to you.
Yes. So good afternoon, or good morning, or good evening to everyone from the various parts of the world that you are attending this from. I'm really happy to be here with you all. And I'm going to try and make use of my 7 minutes, perhaps less, just to try and go through what perhaps the 2 presenters have already talked to us about, and make it perhaps more easier. Yeah, I know as lecturers, we are oftentimes blamed for making it too complicated, but today I'll try to make it a little bit easier so that it's easy to shape this conversation. So I begin here with the quote of Jane Jacobs that we already had from our first presenter. This is a famous one. And why I'm putting it here is for us to have this, to be together from the beginning, that cities are for everyone, right? And I think it's really good that the organizers here try to focus on the informal settlements or the urban informality, and perhaps having a conversation that takes us in a position where we can start to embrace them and understand them better. So with this quote, this is a diagram that most of you might have seen. I'm not going with this, I'm looking at all this, but I'm trying to look at these 5 steps. And what I'm going to be trying to do in the next 2 or 3 fights in what it is of the process of a human-centered design process. And this is a process that can be applicable to anything. It could be the design of a phone, it could be the design of a hospital, the design of a public space, the design of a metropolitan area. The scale is not so important at the moment. And so you can see that it starts from the empathy. You know, when we are collecting stories from the people that we design for and we design with, or we ought to design with, and then it goes, it goes to the next stage. It goes to the stage where we are populating ideas and putting everything together. It goes to the selection stage, and then eventually to the testing. So just trying to walk backwards again. The testing for me is quite dramatic at times, because we go to the field, we can collect lots of data, we design for the people, but there is a question here as to how many of us as designers or project developers are actually able to go back to community and explain to the community, look here, with the data that you gave us, this is what we've been able to do, and see whether there is a buy-in and acceptability from the same community on the ideas. So just trying to emphasize again on what the characteristics of this human-centered project is. And the first one is context. But what does context actually mean, right? When we say context, a lot of people will just think about location. For me, it goes beyond the location. It goes beyond the location. How comfortable are the users of the spaces that we create or we advocate for? How is their emotional state? Are we with them? Are they with us, right? And time, yeah? We are all aware that time is one of the most valuable commodities in life. Yeah? So stopping to make assumptions on people or on the needs of people, but walking the journey with the people together. I think this is very important, yeah? Empathy, I already touched on that, but this is just a deep understanding that people matter and the needs of people matter, and trying to go reach into the understanding of what these needs are. And this is not just current needs, but as well future needs, yeah? So this process is also collaborative, yeah? Because all minds are great and all minds matter and all the ideas are needed on the table. We need to populate as many ideas as possible, even before we can start to see them. The process allows us to be optimistic and to keep high hopes, yeah? No matter how low the budget we have, because the issue of budget is an issue that comes in every day in, day out. With limited time, with limited resources, right? We can actually, start to collaborate and get solutions out there. It's also important to understand that this is an experimental process. Let's take the risks. The risks have to be taken. Yeah, we learn by doing. Yeah, and this is where effective collaborations come in, right? Can we partner? Am I clear to everyone? I hope so. I'm getting a signal of low connection. If it continues, I'll just have to stop the video.
No, we can hear you. Yes. But if you can put the full screen mode.
Then we can see.
Oh, really?
Yeah.
Yes.
Sorry about that.
Yeah.
Okay.
Yeah. Sorry about that. Yes, that's better. Yeah. So the next one, I'm just going to be digesting this again into what is the inspiration for us, right? What gives us, the first one for me is that we need to believe that we are all designers, okay? We need to forget for a moment what our various titles are, okay? We could be doctors, we could be public health officials, we could be, architects, we could be urban designers, we could be policymakers, but all of us are designers. Why? This is because we are strategically thinking about something, right? So that strategic thinking makes us designers, yeah? And as designers, we have to listen to people and find the inspirations within their needs, right? So it's not a situation where we are creating needs and we are creating design interventions from offices and taking it to the communities, but using these needs to inspire the work that we do. So in this perspective, the community becomes a very important asset in the work that we do. Being confident, okay, as we put these ideas through, this is very important. The second point of inspiration here is the comfort of not knowing, accepting to learn, but at the same time accepting to unlearn. Because for many years, there are beliefs that we keep to defend these beliefs, but we need to just let go and get into the context and see what we can do. Okay, again, experimenting, taking the risks. And it's okay. It's okay not to have the right answer, right? So starting with, other than wanting to know whether it will work, first believing that it will work, and you know, trying to be flexible and open in the kind of work that we do. The third one, I would say, get out there. Let's pop out of the box. Let's get out of our comfort zones. And it's important to hear the work in India, the work in Kampala, the work in Freetown, that we are beginning to touch. I mean, we've always touched this. I think we are beginning to touch in a significant way people that live in urban, informal settlements, the urban poor, embracing them into the conversation, learning from them, and just being open to, you know, this new way of learning. And the fourth and the last one is, again, being optimistic. I might have repeated this again, but looking at every problem as an opportunity. Yeah. They say that if we have time to complain about something, we actually have more time to find the solution for it. So again, I think I already said this. So emphasizing on the what if and what if and what if, other than, you know, what's wrong with this and so on and so forth. So if we are able to hear, listen to the people a little bit more keenly, create with them, for them, then the delivery of projects that are have the human at the center become easier to manage. And I think this is something that you might also have seen, but the desirability, the feasibility, and the viability stands a better chance when people are at the center of our design processes and our design thoughts. And this is my last slide. Listening to the conversation from the first, the second presenter, and the introductory lecture that we had, subjective well-being and various other nice terms that are coming in, then it brings us back to the 1960s quote, 1980s quote from Young Girl: first life, then space, then buildings. If you look at the trajectory that urban design, urban planning tends to take, is that, okay, let's have the building and let's have the spaces that the people will come. So this is asking for, this is a lot many decades ago. And so if we don't remember anything from the conversation that we are having today, this will be very helpful. Just knowing that when we first think about life, and then space, and then buildings, everything works, and everything is likely to come back together. So how many more minutes for me?
I think it's up, isn't it?
We will come back to you.
Yes,
that's right. With more questions.
Yeah, so we will come back again in the roundtable discussion and see, you know, how we can actually operationalize some of the things that I'm saying in some projects here and there. Thank you very much.
Thank you very much, Josephine. Really insightful. And I'd like to hand over then to our very creative participants on the ground in Zimbabwe. So Tatenda and Casper, it's over to you both. I'm inclined to say ladies first. Casper, if you're fine with it, then you can follow up on her.
I'm not so sure if you can see me because I cannot see myself. I'm trying to look for myself.
Good. That's all good.
Maybe I can just start by sharing a little bit of profile for House of Art Association. So House of Art is a network of young artists whose main is to develop communities through art. So we do this by we use like what we call our 4 pillars. which are innovation, advocacy, education, and diversity. So basically, we look and we use all the types of arts, and we make them promote. We try to promote development within our communities that we live in. So our network is more constituted with young artists from grassroots and those who are coming from slum communities. I think basically this is House of Art. Then from our presentation, I'll look at probably what we discussed with Tatenda in terms of the first question. We're looking at how people are maintaining social in these global pandemic eras. So from where we come from, these are the communities that we live in. We've also not really adhering to the social distancing policies that are being put with you look families that we usually there are more probably maybe more than 2 households within the same house, like the first speaker said and mentioned before. We see that it's hard to maintain social distancing when there are 3 households within one house or in a small space. And also, as much as the government has put up measures to try and reduce the movement of people within the urban areas, it's also difficult for the people that are in the slum communities or marginalized communities, should I say, to maintain those policies, because our governments, especially down here in Africa, they haven't set what we call relief funds or relief measures to those measures that they've put in place. So basically, people may want, as much as they may want to try and practice the less movement and less loitering measures, it's also hard because most of the people from where we come from the slum communities, they live to hand to mouth businesses and in the informal sector. So at the end of the day, there's no adherence to those social distancing measures. People are finding it hard to sustain. So they end up also trying to make ends meet, and then they start also doing business as usual. And also probably also because the enforcement of these laws or of these measures does not really work also because from where we come from, most of the police that are to do the enforcement, they come from the same communities. So they know what's happening there. At the same time, they have relations with people that are living there. So you end up seeing even the people that are supposed to be enforcing these laws or enforcing these measures also doing the same thing that everyone else is doing. So the maintenance of these measures is actually not being adhered to because of that. Then we're also looking at maybe how the challenge that we are facing as programming team, or professional challenges that we are facing in terms of trying to work around in public spaces. Because of the lockdown that has been set, there's no public transport that is conducive, or there's no enough or adequate there's no enough transport for everyone who's also in the sector, in the formal sector, that has been allowed to work, and also those who are providing essential services. You find that people wake up early in the morning, maybe from 6 a.m. up to until 11 a.m. before they even find transport to go to work. So as much as the government has also set up these measures to say people should only use on the public transport company, it is not able to also provide with enough transportation to the people that are supposed to be working, essentially those that are also working in response to the pandemic. So it also comes down to us as also people who are trying to work to also fight against the spread of this pandemic, in terms of that, and also probably the resources that we may need also when it comes to working with people within the communities. Because of course the government may say we can hold meetings of less than 50 people, but at the same time you need to also have protective clothing for everyone. That is for masks, there's need for sun temperature testing, quite a lot of things. So to also constantly having those things, that would be needed regularly. So that's why we also had to come up with maybe other initiative. We were supporting other young people who are doing measures of maybe creating or designing some masks that are reusable in African way. So, and also looking at even the spaces that we work in, some of them are not really health-wise certified because they are not really conducive. We cannot work on those spaces, especially those that are owned by the government. Most of them are not conducive for the kind of work that we'll be doing, because usually we also need to have sanitation, to have water and all, but the city councils are not able to provide with water. Recently, the other area of Zimbabwe, which is Bulawayo, or I mean, the council could not also continue to provide with water. It just is stopped unexpectedly. So which means the people from that area, which also has got a number that is now increasing in terms of COVID, they were more affected because they didn't see it coming. It just caught them off guard. So these are also some of the things that some of the challenges that we will now be facing as people who would also want to work in these areas. Yeah, I think also Tatenda can take it up and add on to add on some of the things that we discussed.
Okay, thank you, Casper. Maybe also to just add on to what you were talking about, the challenges that we are facing for us to do our work as the maybe professionally. What I can also add on is that, like Casper was saying, that the government, there are policy provisions with no resource allocation, and then like it was announced that it's now level 2, whereby all those who are formally registered can go to work, but it also came with some strings attached, that the employers that are supposed to do the COVID-19 tests on all their employees, and which it is quite expensive, a private test, $65 per test, depending. That's the minimum that you can get to work and respond to COVID-19. And also maybe what I can talk about is the interventions that you are doing in public, like the interventions that are required in public spacing during COVID-19 that we can do. As also fast, like Casper said, we use art as a tool for development, and most of the informal settlements, art really speaks a lot to the people. What can be done? Maybe there's need for us to do graffiti that communicate the measures of how we can keep the spread of coronavirus, so that so many people within the informal sector, they can get to get the message. And also we will be raising awareness of COVID-19, and also as we are raising awareness, we are building a new culture within the community. We are bringing social change, where like in most informal settlements in Zimbabwe, they are hotspot for outbreaks of diseases like typhoid and cholera, which have same which have same means of spread like COVID-19 problem. So as how we can keep the spread of corona, advocating for more water points, you are also helping keep the other spread of diseases that are already a informal settlements in it's become another public space that we are now utilizing as an association to spread the message, like we are doing skits, raising awareness on COVID-19, how it spread, how do you protect ourselves. So we are using social media as a public space, as most of the spaces, the traditional spaces that we are used to attend to as our public spaces are now closed due to COVID-19. And also some of the things that we have noted as House of Arts is that the community-driven public spaces, those are the ones that have that are now operational. The traditional ones that are controlled by government and councils have been closed because they do not have they are not meeting the regulations of the government for them to be opened. So like the churches, when we want to do our workshops, like recently we were in one of the locations in Bering, where we were to do our workshop on how we can view on the dream and design workshop, what are the dreams of the young people and how can we use those dreams, you know, to build the vision of the communities that they want. We had to do it in a community public space, a youth center, a privately owned youth center. So what you have seen is that public spaces, like what Rasmus said earlier, that they should also be responsive to emergencies. They don't have to be closed because there's an emergency. So this is what we want to work on, is also fast that the public spaces, they also get to be used they get to be used during emergencies. Basically, I think this is what we are all about as also fast, and what we are also doing in relation to COVID-19.
Thank you very much for your contribution. I hope everybody could follow it despite of the technological difficulty. With that, I would like to slowly come to end for my part and hand over to Hendrik, that you can moderate the Q&A session. But it shows you really the diversity of what we're dealing with in different parts of the world, and how we can actually tackle some of that. Often what I found is when we're trying to improve it, we really have to be choosing slowly our narrative. Do we want to foster a paradigm which is positive and inclusive and try to create the conditions where life can flourish, or are we just coping and reacting to certain streams? You know, I mean, there's this one quote from Noam Chomsky said that once: history has shown that more often than not, loss of sovereignty leads to liberalization of the imposed in the interest of the powerful. And public spaces are often the spaces where it really shows first and foremost. So over to you, Hendrik. Thank you.
Yeah. Thank you very much for all the presentations. And I found very interesting also what Tatenda was saying. Unfortunately, the connection was not always perfect, but I think what I got from your presentation also, the one point is that some of those government-provided public spaces actually are the ones that now basically not very helpful because they are locked down, and basically those community organized public spaces seem to be running and open, and something is happening there. And I think there was something that we also heard when we talked with Mews about New York, for example, which is kind of interesting because much of the money goes into those kind of government designed public spaces, but then in those crisis situations, we cannot necessarily use them. I had the feeling, I have actually quite a number of things I could ask. I felt like I cut short a little bit KT, and also I think that from Josephine, I would have liked to hear a little bit more also, seeing the situation, maybe start with KT, I think you showed very well how this is the whole migration problem is basically eroding entirely what has created the informal settlements, right? Because basically the whole population of those migrants seem to be in flux and have not the basis to stay there and so on, right? If I understand as well, and the scale of problems. No? So I was just interested maybe in one or two sentences. Can you say something a little bit about what can professionals, what can people from health background or designers and planners do in such a situation? Because it seems like of a scale, it's very difficult to interact, right?
Right. Thank you, Hendrik. I think I'll probably take from what Josephine ended the last slide of hers. I think it was a brilliant slide which talked about the need to understand life. And I think that's what is clearly staring at our faces. Because there's a sort of paradigm shift in terms of how the cities contain its reserve labor forces. And the informal settlements as a consequence of that. And I think that the crisis of the public health crisis is one element. But I think what the public health crisis has done is to show and unmask the hugely inequitous, unjust kind of equilibrium and about spaces in cities. And I think that is what has exploded in our faces. And therefore, the redesigning will have to come from a recognition of what life post-COVID is going to look like. Let me stop at this point, and then maybe we can come back again.
Yeah. Thank you.
A complex question, Hendrik, but you gave.
Yeah. No, thanks for being kind of concise. Now maybe Josephine, because also you didn't have because we give each of you only 7 minutes, right? It's kind of very short time. You also didn't have so much time, obviously, because of that, to talk a bit about like. Now, in the community in which you are working and so on, what are your experience there on the ground at the moment, and how can you work? For example, I think maybe even also the others want to refer to that later. Like, for example, we've seen those great works maybe that Rasmus showed and so on, and how public spaces maybe can help. But of course, these are also the places where viruses spread, right? So that's also why some of those government places are closed. And there is a kind of course, also a certain danger. On the other hand, there are also the places where people can come together. How do we deal with this in such a kind of emergency situation, no? or then on the longer run?
Yeah. Thanks. Yeah. Thanks for the chance. I will come in really quickly. So for me, the first problem is a problem of definitions. Okay, definitions. And this will help to also that someone is asking, how do we protect informal settlements? But with the question of public space, for me, is also a question or a challenge with the definitions. Because if we look at the global the Charter of Public Space, taking public space to be only the places that are accessible by all, freely and easily accessible by all, without a payment and without anything. And the fact that when we talk about public space, a lot of people have an imagination of that big green area out there. And for me, this is where, you know, the little problem, you know, starts to get even more complicated. But if we understand public space, not just as green areas or blue areas, but also incorporating gray areas like streets, right? No one as such has told us not to be on the streets. And what I've been observing in my neighborhood is that the streets are becoming more, are finding need to do activities on the neighborhood street. The parks remain closed. We do not have parks per se in Kigali city. There are traces of that in other secondary cities in Rwanda. But the neighborhood street actually has a very good opportunity during this pandemic to reclaim itself and to rebrand itself. as a public space. People are on the streets, people are doing sports on the street. I see a lot of people jogging in groups, doing exercises in groups, and that has become an attraction in itself. So children are going there to watch, people from the neighborhood are going there to watch, and that in itself creates a scene and a process for social interaction. Yes, we cannot assume, we have actually to keep the measures and so on and so forth. So this whole idea of just the definition and the understanding becomes very important. And has been the bigger topic of today. What is informality? Informality is very diverse. Yeah. What is informal in Rwanda might not be informal in Kenya, in South Africa, in Italy. And so, you know, this effort to always want to localize, you know, again, coming back to the context that I pointed to, and trying to understand what informality is for us and how do we navigate around it. You know, other than always going for these, what I call Western catalogs of everything and saying, this is a description and we have to go with it by this. But a little bit trying to ground these aspects and these notions, yeah. Like the first, in the beginning, this conceptual angle of the subjective well-being and actually taking it to the cities and testing it and trying to do different kind of things. Personally, to put in more effort in. And so it becomes clear when we say public space, what do we actually mean? When we say informality, what do we actually mean? And this makes the problem, in my opinion, it makes the problem a lot lighter than it actually is when we are looking at it from a distance. So COVID-19, people have said many things about it. Theorists have said that this is an amazing grace for the continent, especially in Africa, where we have lots of resources, but oftentimes we tend not to believe in our very own resources, in our very own knowledge, in our very own indigenous concepts and conceptualization and typologies of issues. So now we cannot actually, you know, get out of the continent. I mean, flights are not operating as yet. So we are being asked to actually think. So for me, the season is a season and see what do we actually have. Meaning, what new meaning can we place on existing resources and knowledge? And I think for me, the post-COVID season looks very promising in the whole conversation of public space, be it health, be it this and that. There will be many more benefits from it than just, you know, the losses and the economic, you know, doom that is being talked about every day. I should stop there.
Mm-hmm. Thank you. I could continue listen to you because I find it's quite interesting point of views. Of course, the question of the street, I think, seemed to be actually something that goes around also in many other places, and it I think many urban designers and anyway for a long while talk about the role of the street, but also in this pandemic that some of those kind of formally created public spaces are not so successful than streets potentially, no? But also the kind of local knowledges that exists, and it's great to hear about this. Now, what I want to, even though I would like to hear more from you about this, but I think for fairness, maybe I give now to Yin-Fen to check for the questions that attendees have raised, and to select some of those questions and give back to our panelists.
Yeah.
Thank you. Mm-hmm.
Yeah, thank you, Hendrik, and thanks for your fascinating presentations today. And here is a question, I guess it's directed to the professor, to Rasmus. And I think this attendee want to hear much more about, by the end you mentioned that concepts about that nexus space. And maybe you can elaborate more. It seems like by the end you only tell us like in the future when we are developing this kind of public space in informal settlements, we can both thinking about that could be useful no matter in the development process or this kind of emergency context. But could you maybe tell us more, or like have some example to let us understand about these concepts much more? Thank you.
Thank you so much, and also thank you for actually elaborating on the concept for me. The reason I put that concept in there is because I think it's really interesting that we have this debate. A lot of us, or not me, but a lot of us here in the panel are coming from the discipline of space making and place making and urban design. So I mean, to place that into the context of informal settlements, to place that into the concept or the context of development, is also to try to use the words, use the trends, and use the knowledge that's taking place within development right now. And I mean, all over the world, when you do development, you think about the nexus. So it's like you can't do an intervention, you can't do a project without thinking, what if a disaster happens? It can be climate related, it can be health related, it can be political related. So it's really to help us almost think in a way as a risk and mitigation strategy when we develop public spaces. How will they actually react when this crisis happened? So that's why I think there's a lot of interesting knowledge to pick up in the development world. In Denmark, we're actually seeing it. I mean, we talked about Mwongeli. We see these spaces right now. I mean, now we develop these cool playgrounds that also dubs as collecting the rainwater to reduce flooding. And we have these like very expensive, but I mean, cool examples of how these like nexus spaces can be developed, which I think there's also a lot to learn from, because I mean, in an informal settlement, it's defined by there's a lack of space. So if we don't really think about how to put different functions into a space, it's going to be challenging. And then I would also like to link it to what Josephine was talking about with the whole localization agenda, which is also something that relates to the nexus, especially when we move into the humanitarian field. Localization is one of the core principles in the core humanitarian standards. Everything we do needs to be anchored in the local knowledge and in the local ownership, so that we design these interventions based on the inputs and based on the knowledge and based on the leadership of the people who's affected by it. So I would love to elaborate on the concept by including the idea of localization. I mean, include the local perspective on what are the challenges that we experience, how do we make the space conducive in times of peace, and how do we make the space relevant and ready when disaster strikes. Thanks.
Yeah, thank you. Thanks for your answer. And I probably just keep moving to the next question. And here's a question I want to maybe ask all of you. And this attendee, he wants to know about how could we protect people living in informal settlements, especially under the influence of COVID-19. Because in his point of view, he thinks special access and adaptable public space is very important, but they are not enough. If a man living in this kind of place get COVID-19, it will be a disaster. And advices like go home and isolate yourself is meaningless in this kind of a crowded inner space. And so that could be a challenge. What's your opinion or thought about in this kind of situation? How could we use public space or other methods to help people living in this kind of context? And any of you maybe can just, if you have thought, you can just jump in to answer that.
Maybe we can also ask Tatenda
Yeah.
and so on. That, yeah.
Okay. Thank you so much. Maybe. Okay. Thank you so much. Maybe to just say something. The people who are in the informal settlements, like they have to be, what can I say? They have to be active participants. Also, like what we do here in Zimbabwe, like during this pandemic of COVID-19, like we are working in Bering. it's the residents, it's the young people who advocate to the local authority, say that we don't know much about COVID-19. We want to learn more about it. And also, I think I'm not sure how I can address this, but it's always on the locals. They have to come up, they have to be strong, they have to build, I don't know what can I say, they have to learn to advocate. I'm not sure, maybe Casper can get in and say something about it.
Can I?
Yep.
Can I maybe just come in if we lost?
Yeah, thank you. Yeah. Please go
so,
ahead.
I mean, this is a good question, I think, for the forum, considering that people living in informal settlements, for them, a pandemic is like a double disaster in a way. We are aware that people in informal settlements do not have access to decent domestic space or private space, like maybe the rest of the classes in the city have. And so when a pandemic comes and one of the measures is stay home, it becomes quite challenging for the people. And I think we've seen a lot of news around on how difficult it is to contain the pandemic in the informal settlements, because some governments have tried to give food to the people, take the food to the people, but that's also, it's not been very successful. Maybe we need more time, another forum to actually come to look at all these pictures and videos of what's happening around the informal settlements. So for them, the impact is we could say, is much bigger than maybe for the formal. But for me, I find this a bit paradoxical in the way that the way informal settlements are formulated. And the issue of definition is there as well. For example, in Rwanda, informal settlements are not illegal. It's not an illegality. People in informal settlements have the land titles for the land and so on and so forth. This is not the same as a very close city like Nairobi, where informality is an illegality, and so on and so forth. So what I find as a strength for informal settlements, and it requires caution from us researchers and academia, when we want to just make assumptions and look at them as undesired parts of the city, is that these people are always able, the sociability in informal settlements, in a way, if I can use the word sustainable, is that these people are always able to make do, with the poor conditions. For me, social life is really, from what I see in informal settlements, is very rich. These houses, the houses are not so good, but the fact that there are no fences around the houses makes the children, very free with each other. Children can just run out. Every open space inside an informal settlement is a play space, is a scene for interaction. Women are, sitting on little L's in informal settlement, chatting or selling, vegetables and fruits. And the composition of an informal settlement itself becomes a solution. I mean, when we have a pandemic that requires us to keep social distance, I don't like the word social distance, physical distance. It requires us to wear masks, so we cannot chat as we used to. It introduces us to a new normal. But I see informal settlement dwellers not having that opportunity to learn the new normal as maybe the affluent neighborhoods or the formal neighborhoods will. So for me, the resilience in informal settlements is a lot higher and a lot better than perhaps formal neighborhoods. And I know that this is a bit paradoxical, but it's just something that needs us again to open up the box and see the realities. And again, across contexts, because the reality in Rwanda will not be the same as Kenya and South Africa, or the different parts of the world where the participants today are coming from. And so these are some of the things that I make observations and collect empirical data and see what evidence we are getting from this.
Yeah, thank you. And anyone still want to respond to this question? Or do you have any experience you see or you know about what's going on? Or yeah, Rasmus?
Yeah, just a very short comment, and I think we talked a lot about it, also relating to the localization. When we talk to the people in the communities right now about what are the key challenges they experience, they don't talk about health-related issues. It's about livelihood, and it's about the negative effects that's derived from different government policies and so on. So livelihood, violence, these kind of things. And it also just talks into like these basic rights that are violated, not just through a crisis, but it's violated in general: access to water, access to infrastructure, access to sanitation. So I think, I mean, this discussion about the situation during COVID-19 should just be like, it should be a way to advocate for some rights that's much greater, that doesn't just relate to the situation right now, but relates to a situation in general that needs to be changed.
Yes, yes.
Maybe if we see like for KT, you were also mentioning different policies in different Indian states, right? So you mentioned like Kerala, for example, reacting very different to other states, right? Would there be something you want to share with us? Like, I think we have probably a lot of problems and so on, but maybe also to see where do you see kind of directions, more kind of humane, better policies where other people could learn from?
Yeah.
Or work on the ground. Yeah. Mm-hmm.
Yeah, I think there are 2 or 3 things that I'd like to say. One is related to how cities see themselves. And this requires, I mean, the pandemic in a certain sense, I mean, the points that my colleagues in the panel have also been making in terms of public spaces. The recognition of public spaces needs a redefinition. Because a lot of the public spaces have been created in a context of private use. In a context like the COVID-19 pandemic, that has been exposed quite considerably. To what extent were, for instance, temples, mosques, churches, public spaces? To what extent were schools public spaces? And I'm now trying to differentiate, because I see that some of my colleagues on the panel are, for instance, talking about most settled communities, while I'm largely speaking about a more floating migrant community. So there is a difference in the way in which these sets of people who are part of the city are responding to what the city is doing to them. And that's why I said that the experience of the city maker of the city is an experience, and it's a lived experience that has to be understood. I also see, for instance, there's a Q&A question which is here for me specifically to be about an enterprise level experience. And I see that I want to also bring that question to my response to what, Hendrik, you are asking me. The migrant has, has recognized that there is a fragility in the Indian context, and I'm sure that that's not just the Indian context, that's a context I'm aware of fragility about the experience of the Indian cities. It's non-inclusive in nature. It has no clear employer-employee relationships. It lacks enumeration. It lacks, of course, basic urban services and human living conditions. They have no access to social security benefits, and most importantly, a lack of political participation in urban areas. And the lack of political participation, in a certain sense, is one of the first things that they experienced when the pandemic happened, because they were last in the order of governance focus. And they were the first ones to experience, therefore, the lack of an understanding of their living. I think that, you know, the migrant population in cities, there's an assumption that migrant workers, especially workers who come from between provinces and states, are more liabilities than assets. And these misconceptions are backed by state-specific, domicile-centric, socio-political sentiments. And when we have this reverse migration, we probably will now begin to recognize the centrality of this population, which has actually kept the cities going. They've been the labor force, and they've therefore, I mean, the word informality, like Josephine was saying, I think it's worthwhile trying to unpack that word in the context of the pandemic. I think this unpacking is very necessary. What is being experienced at the enterprise level is a complete sense of distrust for the system that they have been part of. They have experienced a distrust of a nature and of a kind. I mean, they've always known that it's unjust. It's not as if they don't know it's unjust. But what they've seen in this context, at least in our cities, has been that they have completely recognized that they're left in a very, very difficult situation because they have not been part of the governance focus. So I think that that's the point I'd like to also bring in terms of looking at the consciousness of people who populate our cities. The domicile nature of understanding cities is something that has really come up for a rethink. We have to begin to reimagine our cities for a 30% of population whom we'd like to keep in subhuman and invisible conditions. And I think that that's the political trajectory that will have to be questioned. Thanks, Hendrik.
Okay, thanks very much. I think our time is almost over, even though I would love to hear more from all of you. I would just pass back the word to Louisa, but before that, just thank all the panelists from my side. I have seen many interesting contributions, or heard particularly also how we need to unpack all the kind of differences within informality, and also how different maybe also the situation might be in some areas like India, maybe even in different states vis-a-vis what we heard from Rwanda and Zimbabwe. And then of course, there are certain points where it connects and so on, right? So I think a good starting point for further discussions. With that, I want to give, so thanks everyone, and I want to give back to Louisa for the announcement for the next event.
Yes, thank you, Hendrik, and thank you to all the speakers also from my side for this very rich and complex discussion. For all attendees, since we always receive this question regarding where we can listen to this webinar. So all our webinars are recorded, and this webinar as well. We have a YouTube channel of City Space Architecture. We have just published this morning the 4th webinar of the first series. So now all 4 webinars of the first series are uploaded online on the YouTube channel of City Space Architecture. And soon also this webinar will be online on the same channel. I'm happy to introduce briefly the next webinar, which will take place on June 11th. This webinar is about innovative approaches and creative practices in response to COVID-19 pandemic. As you know, the second webinar of the month is dedicated to this specific topic. Next week, this webinar will be hosted by RMIT University based in Melbourne, and it will be about speculative cities thinking forward, exploring speculative practices and how they relate to and or change public space in the current and post-COVID-19 conditions. We will have an amazing panel of speakers again. I am happy to see that we are able to engage always very interesting researchers and practitioners to talk in our webinars. We are about to publish the program of the webinar later today or tomorrow morning, so it will be available 1 week ahead, so you can register. And then, of course, we wait for your feedbacks, because we have a survey for webinar feedbacks. If you are subscribed to our mailing list, you will receive also the link to answer to the webinar feedback, and all information are published on the webpage of the Journal of Public Space under the menu COVID-19 that you can find in the homepage on the horizontal menu on the right. So I think it's all for today. Thank you again to the speakers, to the hosts as moderators, and to the event managers. And see you next Thursday. Bye.
Thank you very much. And see you next.
you.
Bye-bye.